back to Overhead Athletics. Today we're actually going to do a session assess. We got Colby here, who's been in a video of ours where we actually assessed his internal rotation deficit, and we actually analyzed how to properly assess internal rotation in a throwing athlete. We look at pure glenohumeral internal rotation without actual shoulder complex mobility and movement and compensation with anterior humeral head migration, forward tilting, or internal rotation and anterior tilting of the scapula. We're going to look at it here. He's a bit sore. He's been throwing a lot. We just did a little bit of a light workout today, and we're going to actually go into some manual therapy, get into some massage work, get into some manual muscle stretching here. So go ahead and lay on your back. Right-handed thrower, throws pretty hard, upper 80s to the low 90s. You can see he's already stiff and I haven't even stabilized that shoulder complex. So what I like to do is take him here, stabilize, pin him posterior, and then take him up into internal rotation, see where he gets. And we talked about how we can analyze shoulder rotation from here and look at how much he truly has. So push up into my hand, lightly, relax, good, go. Nice stretch, any pinching. So we don't want any symptoms, relax, of impingement. You can see I have him in the scapular plane because I actually elevated his leg here, push. We'll take him as much as we can. We'll get as much range here as possible before we actually go into any joint related mobilization. Relax, how old are you? 19. 19. So with the 19-year-old, we may see some actual capsule restrictions with as much as he's thrown. Push up. So he went through junior college ball, relax, junior college ball, then he's now in summer ball. He's in a collegiate league this summer. He's pitching, so he's getting a lot of innings. He's a starter in college. Push up, relax, okay. And that's about probably all we're gonna get. Now he's come across bilateral comparison. See a lot more. And I just like to see what happens as I take him up, let him flop. I'm not controlling it at all. I'm just pulling him up into abduction. You can see I get him into terminal end range abduction with no flop into ER. He's probably still 10, 15 degrees into internal rotation here. So let's see what happens here. We lose it, and if he relaxed, just let it go floppy. You can see he wants to fall out. So I've traditionally gone with 10 to 15 degrees. I just recorded a podcast recently with an individual who, and I don't want to disturb anything, but I have not released it yet, so I don't want to break up too much of the content. But I actually did a podcast recently with an individual who's kind of a researcher, physical therapist, epidemiologist, who is getting his PhD from Oxford. Push up in my chest. And he said 5 degrees is probably a better mark. 5 to 10 at the most, 10, relax. Push up in my chest, relax. And that's, I like to hit it hard with some stretching and mobilization before we do our soft tissue work. It's really nice. We're actually going to do some Graston and stuff on him, so relax your arm. It's nice that we had him pop his shirt off before the video. It's nice we can see with the shirt off really how the shoulder moves really well. So if you're not sure and you're not sure what you're feeling is what's actually going on, have them pop their shirt off. Good. So I can always finish up with some oscillations here at the end. Once again, this is going to be less specific, and I like to use these oscillations just to kind of reinforce my range of motion, get athletes used to it. Sometimes this can be a nice little warm-up as well. You can see he's tight that way. So you guys need to check out the podcast that's coming up with Garrett Bullock, because we talk about all different things, scapular dyskinesis in throwers, and like I said, Garrett was getting his PhD from University of Oxford. He's got a doctorate in physical therapy, and he's done quite a bit of research. I want to say 73 publications. Great episode, but we did talk about that internal rotation. And he has some unique perspective as a former professional pitcher as well. So a professional pitcher, a doctorate in physical therapy, getting his PhD, doing a lot of research on baseball players is always nice. It's always great to get as much information from those individuals as possible. We're going to stretch him up overhead. So pin the shoulder blade at the middle of the axilla here, middle axillary line. Take him up, see what he has. On this one, I am looking for symmetry. So while I might get 5 degrees, I'm looking for 5 degrees on the other, I'm looking for symmetry on this one. So a little variation on the other is okay. Here, not as much. You're gonna scoot over towards me. Pretty easy to get this stretch on your own. I use my hip. I pin that scapula. And I don't really pin it back, but I keep it from coming up. So I don't know if it's as much lat or teres major for him. You feel the stretch more right here. Right under my hand. Okay, that's cool. And the elbow I can control for ER a little bit. So I got him pinned on the edge of the table. I'm using my hand here to support, pushing my hip. We just got done, like we said, we worked on a lot of core stability type training. Just getting the arm moving again. Getting the arm moving, getting the body moving a little bit. He's actually been doing quite a bit of work as well. So works in manual labor, and that's what you'll see with a lot of these college guys. They gotta make money here in the summer. So while he's pitching, he's also taxing his body with a lot of things that aren't quite easy on your body. So his training is done in addition to, working 40, 50 hours a week. 40, a good 40, because you're usually here, right? Driving right over here from work at 7, heading home, doing it the next day. So, when guys pitching, playing a lot, accumulating a lot of load over the season, we'll a lot of times have to deal with work schedules as well as work routines, which in his case is landscaping right now. Lay on your side and face that way. So relax your hand. We love functional massage. So functional massage, incorporating joint movement. Relax, just let me hold you. Elongation, shortening the muscles. I'm actually giving them a force-directed inferior. So I'm actually working on driving into the muscle in an inferior direction here with this grip, which allows me to get somewhat more focal of a pressure here as I actually lengthen the lat. Teres major. So we stiffen the lat, he holds some tension there. Then I'll come in, do some functional massage. He's sore up into the upper, slacken the muscle proximally so I can actually get into the muscle and then stretch it. I'm doing a grab and pull, trying to minimize any skin shearing. And we've noticed that functional massage is one of our most effective management strategies. We did a podcast as well, another one I'm going to plug, with an individual who's a chiropractor, physical therapist, master's degree in biomechanics, spine biomechanics, and that's Greg Lehman. So now you got Garrett Bulk and Greg Lehman both to check out, but we talked about how manipulation, massage are probably going to give us 3 to 5 days worth of relief, which we'll say, okay, well, many people are cynical in that they'll say that's not really worth us doing. Well, with him, we can help him recover a little quicker, which means he can maybe get one more bout of training in. If he can get another bout of training in, at the same time he's getting another bout of training in, he's able to feel a little better for his next start, and that was an effective strategy for him. More up in the top than back here. Yeah. And so now I'm just coming around, hitting posterior shoulder a little bit, just briefly here. But this upper trap massage is sometimes really effective. We'll probably hit him a little bit into this pec here, Then we'll go into the actually posterior shoulder with Graston. So go ahead and stay on your side, roll a little bit forward. You got the deep prep. So we're always managing recovery in these guys. And when did you say you might pitch next?
Saturday.
Maybe Saturday. So he might be on this weekend. The time of filming this video is Thursday. So you pitch Tuesday.
Yeah.
So Tuesday, Saturday, decent rotation. Threw a decent amount, more than what he has in a little bit. So he went through his collegiate season. Now he's into that summer season. And in that summer season, it's really to try to get better. Collegiate season is all about performance, and summer season for him, you know, he's moving on to Division II. He's going to play at Grand Valley State University here in Michigan. Pretty good baseball school. Got a good program going there. So him moving into that, you know, we're trying to just manage things as much as possible and give him the best opportunity to. So Graston, I actually have the more diffuse edge on him here with the banana. Graston number 5. And then we might just come in and scrape all of the front here, the pec. Now we come in and use that more focal side once they get used to a little pressure into that insertional area. And how deep are we getting? Well, you know, that's something we discuss a lot. We're just discussing with one of the therapists that works with a lot of our throwing methods. Really, we're providing some neurological stimulus. We're loosening up some of the subcutaneous tissues. We're getting some massage actually into the muscle itself. Just trying to get the whole system to feel a little better. Okay, let's go on to your belly here. You don't need to spend too much time on any one body part. Tuck this hand under your pocket, would you? You don't need too much of the actual material. I always like to palpate, make sure we're kind of starting to loosen up and take care of some of these soft tissues. So never underestimate your soft tissue mobilization, your recovery management strategies, and understand that athletes have soft tissue limitations acutely after throwing. They'll lose some internal rotation, generally lose a little bit of horizontal adduction. And just getting into some of these tissues here can actually help to relax them, recover some range of motion, provide some neurological stimulus. But always know that like certain points are a little bit more sensitive. I try to stay off the spine of the scapula. I try to stay off the borders, angles like the inferior angle. Stay into where there's a bit more muscle, but make sure you're getting into that posterior cuff. He actually feels like right out here is where we get a bit more. Just looking for, you know, bringing some blood flow. More areas where I feel like there may be more restriction, I might use that more diffuse contact area where I feel like just the soft tissues don't move quite as well. Slide your head over here. And he expressed some soreness in upper traps. And then I'll finish here just with a little bit more lat massage and scapular adductor massage. But you don't need a crazy dose. You need stuff, a few minutes. All right. If you like the video, make sure to subscribe, hit the thumbs up. We're happy to provide some more manual therapy videos in the future. A lot of times with these guys, we're just managing soft tissue restriction, managing soreness, putting some neurological input in the area, increasing blood flow, which is very important for healing. And then the most important thing is getting them to move better, which is what we've already worked on today with Colby, and improving this technique. So we'll see you guys in the next one.